Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. In this segment, we're going to be speaking with Brad McElya. He's joining us here as a pharmacist, Walgreens Director of Specialty Health Solutions. He's going to talk about the National HIV Testing Day that occurred this past June 27th of 2022 and how Walgreens worked with Greater Than AIDS and local health departments and community organizations to host the largest coordinated HIV testing event in the nation. Welcome to Health Professional Radio, Brad. Thank you so much for joining us this morning.
Thank you so much for having me. I greatly appreciate the opportunity to speak about National HIV Testing Day and the things that we've been able to do with health departments and community-based organizations for quite some time now at Walgreens. So great to be here.
Well, as a pharmacist and working with Walgreens and other entities, you've seen HIV testing plummet during the pandemic, along with other diagnostic services as well. Talk a bit about how the pandemic has impacted HIV testing.
Yeah, good question. One of the things that we have seen, we've seen the decline in the number of tests. It's really a lot of health departments, community-based organizations, and many others pivoted to really focus on COVID testing at a critical time. And naturally, that's the right thing to do. You know, we have to take care of the pandemic. At the same time, we want to make sure that we don't lose sight of the progress that we've had with the HIV epidemic. And so one of the things that occurred during that time is we saw plummeting of HIV tests. And with that, then naturally you do not have the diagnosis that you need to have. For instance, if individuals do not know their HIV status, then naturally they can't get into therapy or they can't take preventative care as well. And so that's exactly what we saw. We saw the diagnosis actually drop, and that's not a good thing. It would be a good thing if more individuals were receiving tests. However, we know that based upon a CDC report that some of the HIV tests even plummeted by 50 to 70%. And so that's even less individuals that are aware of their HIV status, and therefore less individuals that can get into treatment.
The pandemic also revealed many disparities in healthcare among different ethnic and socioeconomic groups as well. I understand that you can also speak to why HIV impacts certain communities more than others.
We do know that HIV disproportionately impacts certain communities for a variety of reasons. One of those reasons that we know, especially with HIV and AIDS, now that we've been in this fight for 40 years or so, is that there are communities that are at greater risk. And so there's certain communities that have higher prevalence for HIV. And then with that, naturally, we see more of an impact, especially during times of the pandemic, on those communities. And one of the things that we saw in 2020 alone, that there were more than 30,000 people that were newly diagnosed with HIV, but certain groups of people in geographic areas continue to really bear the disproportionate burden of HIV. So, for instance, we saw gay and bisexual men accounted for 69% of all HIV diagnoses. African Americans account for 13% of the population, but 42% of the new HIV diagnosis. Hispanics and Latinos account for 18% of the population, but 27% of newly HIV diagnosis. And so we do know some of those statistics around various communities, and naturally that should lead us into coming up with creative solutions for those communities to make sure that we're meeting the needs around every community in the United States.
Well, talk a bit about the work that's being done by Walgreens, health departments, and community organizations to end the epidemic.
Absolutely. We've been very passionate over the last or since the beginning of the epidemic to really make sure that we're partnering with community-based organizations to ensure that we're meeting the needs of the communities that we care so much about. So 11 years ago, we started partnering with Greater Than AIDS in their community-based partnership program with community-based organizations. And what we do with them is we partner with Greater Than AIDS. We invite community-based organizations into our Walgreens locations, or some of them that have mobile units can use our parking lots. But essentially, we have them in our stores to offer free HIV testing around National HIV Testing Day. And so since the program began in 2011, the partnership has provided more than 72,000 free HIV tests. We did have a brief pause during the pandemic. We still wanted to make sure that we were meeting the needs of the communities that we serve. However, what we ended up doing, instead of having individuals in our stores, we ended up providing self-test kits to ensure that folks that needed an HIV test could still get an HIV test. And we did that in partnership with Greater Than AIDS, and those self-test kits were distributed by the community-based organizations. But it's critical for us to make sure that we have the communities that we care so much about, that we have them represented in our stores, and that we're actually learning quite a bit about the communities from our partners. So it's been a very successful program for us. This year, we did have our largest testing event on National HIV Testing Day. Proud to say that it was a big success having partners back in our stores to be able to offer that free HIV test. And it was very well received as we try to get to a new normal following the pandemic.
Even with all of the organizations banding together to fight this, pharmacists are the frontline resource for testing and treatment, including PrEP. Is that the case?
We could be. Mm-hmm. I think that we still have some work to do in order to really put a spotlight on what a pharmacist can do, especially in the role of helping to end the HIV epidemic. However, I do think that we're getting there. COVID really allowed us to have that spotlight and showcase what a pharmacist and pharmacy team members can do, both from COVID testing as well as the vaccinations. And my belief is that we can also do similar things when it comes to pharmacists and helping raise awareness around HIV testing, to actually offer HIV testing, and then also to take some of the burden off of the prescribing physicians when it comes to pre-exposure prophylaxis. Mm-hmm. We know that we have a lot of work to do in order to end this epidemic, and I think that those two things, both HIV testing as well as pre-exposure prophylaxis, a pharmacist can play a critical role in that. And one of the examples for that, if you think about it, at Walgreens, we have over 9,000 locations around the country. And so with that, you can basically envision that we're on just about every corner in every community across the country. And that's critically important to ensure that we have services in communities that may be at most risk, as we touched on a little bit earlier. And so I believe that with the geographical access, as well as having trusted, trained pharmacists embedded within communities, that you really can reach the needs of the communities. We do know that 1 in 7 individuals that are living with HIV still does not know their HIV status. And I believe that with the geographical access as well as the access of a pharmacist, that we can specifically try to meet that need.
Brad, give us a website where we can learn more.
So it's walgreens.com/HIV.
Brad, I appreciate you giving us some of your time this morning. It's been a pleasure speaking with you, and hopefully you can come back and speak with us some more about ending the epidemic.
Thank you so much. Again, I greatly appreciate the opportunity to speak with you about at a critical time and helping to end the HIV epidemic. So thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with pharmacist Brad McElya. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.